Hello, I want to take a few minutes to introduce you to your new OSHA manual and explain how easy it is to use. This is your new OSHA manual. This 8-minute video will show you how your new OSHA manual is designed and laid out. Introduce the written programs within the manual. Explain what the 5 sections within each program are. And, of course, explain how to use the manual to understand and comply with the OSHA regulations that apply in your practice. As you know, OSHA requires employers to develop employee safety and health programs to prevent workplace injuries and illnesses. These written programs identify the hazardous tasks you might perform, how to protect yourself from those hazards, and how to respond if an accident or incident occurs. The policies and procedures in your new manual are based on the OSHA regulations in your state and have been tailored to the activities of your practice. In the next few minutes, you'll understand everything about it. Let me show you how. You'll notice from the beginning that this manual is designed with one thing in mind. It's your OSHA and infection control go-to compliance manual. It has 5 written programs identified by 5 large red tabs in alphabetical order: accident prevention, exposure control, hazard communication, infection control, and infectious waste management. Together, they are your OSHA programs. Each program contains 5 smaller subtabs listing the elements making up that program. The yellow tab identifies detailed written policies and procedures. The blue tab supporting addenda specific to that program. The orange tab includes a copy of OSHA regulations for detailed reference. The green tab presents a Q&A program digest for training and learning. And the forms for your every need are behind the white tab. We'll discuss those tabs in a couple of minutes. But first, the written programs. The Accident Prevention Program, also called the Injury and Illness Program, is about general workplace safety. It addresses general safety elements and practices, such topics as emergency equipment, first aid requirements, and safety meetings. The Exposure Control Program responds to the requirements to protect employees in all exposure potential activities. It includes elements such as personal protective equipment, needle stick prevention, and post-exposure protocols to respond to exposure incidents. The Hazard Communication Program, also known as the Right to Know Law, protects employees when working with hazardous chemicals. It includes the Globally Harmonized System, or GHS, addresses requirements relating to safety data sheets and chemical container labeling. The Infection Control Program is designed to protect employees and patients from infectious diseases transmission. Based on the current CDC guidelines, it combines with the requirements of hand hygiene, operatory disinfection, and instrument sterilization, and to establish the infection control protocols in your practice. The Infectious Waste Program ensures the safe and healthful handling and disposal of infectious waste generated during the normal course of dental health care. It includes segregation of soft infectious materials, inappropriate sharps waste containment, and final disposal requirements in keeping with your local, county, and state regulations. Together, they make up the 5 programs in your OSHA manual. Next, behind each red program tab are 5 smaller colored tabs that identify the 5 sections that make up the program. Each section is identified by a different colored tab. The Written Plan yellow tab includes the detailed written policies and procedures based on the regulations and the activities in your practice. Each program has a 1-page summary of that program, and each program has a table of contents which identifies every topic by section and page in the program. Unlike OSHA programs you've seen in the past, it has photos, images, charts, and graphs for reference and clarification. It's about your practice. The blue tab Addenda includes supportive information in the form of fact sheets prepared by experts in the field. Depending on the program, you'll find information about everything from responding to a bomb threat, treating sharps injuries, and a full discussion of the GHS pictogram definitions. Addenda information is like extra credit reading. It's always relevant and related to the written program it supports. The Regulations tab, the orange tab, includes the regulations for each program. OSHA requires employers to have a copy of each on site and available for their employees' use and reference. The policies and procedures in your written plan are based on those regulations. The Program Digest section, the green tab, is the Reader's Digest question and answer, yes and no version of the lengthy written plan. Each question in blue represents a specific OSHA requirement, and the answer in red describes how you are complying with that requirement. Remember, if the digest answer is yes, but your practice is actually doing no, you need to change what you're doing to be in compliance. The Forms section, the white tab, includes the forms that are needed to document actions you are expected to take if certain events occur. Many of the forms won't be used because the events requiring documentation won't occur, but you must have the appropriate forms available. Take note of the Forms User Guide in the front of each Forms section. The title of each form is listed on the left column, and an explanation of when and how to use the form is in the right column. Here's a little tip. Now that you understand how the manual is laid out and what each section does, using it couldn't be easier. Read it from the inside out. Taking one program at a time, read the Program Digest first. Then read the Forms User Guide. The Program Digest tells you what OSHA expects and what you're doing to comply, while the Forms User Guide tells you when to take action. Then read the written plan, which provides a more detailed description of the requirement and walks you through the compliance procedures. It's just that easy. There you have it, your OSHA manual and how it works in less than 8 minutes. Remember, if you have any questions, just give us a whistle at 866-548-2468.